Heart disease is the nation's #1 killer. 15 million Americans have it.
And it kills more than 600,000 people every year. That's 1 in every 4 Americans.
Sometimes, though, it's difficult to diagnose, especially if a stress test, the first line of defense, comes back normal.
Health editor Dr. Maria Simbra reports on a new test that's cutting right to the heart of the matter.
I always refer to them as episodes or spells.
Karen McCarthy had shortness of breath and chest tightness radiating to the left arm and jaw. And she had a strong family history of heart disease. Her father had a triple bypass at age 49, and 7 of his 12 siblings died young of heart disease.
Even though I was a young woman, they would bring me in, and I've had numerous stress tests, echocardiograms and things of that nature over the years, but they would say everything is normal and you go on your way, and sometimes I can go years without one of these episodes.
But heart disease was always on her mind, especially after her husband died suddenly of a heart attack at age 47, even after a normal stress test.
My children had already lost one parent to heart disease, and I didn't want them to lose another.
There are instances when the stress test may be normal, but maybe the patient continues to have symptoms, and then and you still feel concerned enough to say, well, maybe we should do another test.
The next step would usually be a heart cath, with tubes and wires threaded up through the vessels to the heart to assess blockages, with a small risk of complications, such as a heart attack or stroke, but in many cases, it's a lot of invasion for little abnormality.
2/3 of those patients end up with either normal or just mild blockages.
In Karen's case, her cardiologist recommended a new test called the heart flow.
The FDA-approved technology was part of a pilot program in 2016. The test was performed on 100 patients, and Highmark Health says unnecessary caths decreased by 83% and cut costs an average of 45% per patient.
The heart flow is a special kind of CT scan of the heart. It analyzes something called fractional flow reserve. The doctors send the CT images to a company in California for a special computer program.
They take our CAT scan images and they can analyze it to identify if the flow is normal through those arteries or is the flow being affected by the blockages.
If flow is normal, the patient won't have to get a cath. If the flow is below 80%, the situation becomes urgent.
He said, we got the results back. You have a significant blockage. We need to send you to the cath lab. I really wasn't expecting that result, but it was anywhere between 80 to 90% blockage. So I was basically a walking time bomb.
Karen got the call on a Friday. She was in the cath lab the following Tuesday and had a stent placed. She also had her children checked and followed by a cardiologist. She is glad her doctor persisted, despite all the normal heartbeat, ultrasound, and cholesterol tests.
Those are the results you want to hear. You want to hear that you're normal. You want to hear that you don't have a problem, and so you're like, oh, this is great, this is wonderful. And you don't really pursue that next step because you think that everything is good. But the fact that the doctor did prescribe this, and he did push this, and we did go this next step, I truly believe it saved my life. So if I can have these types of issues with my heart at this age, anyone can.
I'm Dr. Maria Simbra, KDKA News.